A vaccine clinic held here after a probable outbreak of at least 2 cases of whooping cough. I'm your De Pere neighborhood reporter Carl Winter talking with healthcare professionals about the disease. When you say the probable cases this week, I guess what does that mean?
Without laboratory confirmation, the clinical symptoms are, they align with the illness.
De Pere Health sent out a memo to De Pere High School parents earlier this week, warning them about at least 2 probable cases. They would not say exactly how many, and the school district told me the district cannot comment on individual student health issues. Whooping cough, one of the main symptoms is in the name. What are the others that people should know about?
It'll often start out with symptoms very similar to a typical respiratory infection. Runny nose, congestion, and maybe even a minor cough. Often not a fever.
But then it can worsen, with doctors saying coughing can last for 3 to 6 weeks.
You can see more prolonged coughing spells that can sometimes end with a sharp inhalation that sounds like a whoop, which is where the name comes from.
They say whooping cough is most dangerous for young children who could stop breathing, but that adults contract it too.
We're seeing higher rates of pertussis with the adolescent and adult population than we used to in the past.
Which is why they recommend visiting a vaccine clinic if you need it.
Immunity wanes with vaccine, and again, that's why it's so important for people to check their vaccination status, make sure that they're up to date on their vaccinations.
The health department will continue to issue exposure notices to groups who may have been exposed to the disease. Its next vaccination clinic is scheduled for May 15th. In De Pere, Carl Winter, NBC 26.